Hi, welcome to another video, the last video of 2023. So started this journey making videos about health inequalities, a year ago now. Initially just did it off a whim because it was something I wanted to do. Some things I just wanted to get off my chest. Other times just wanted to kind of, make people aware of things around what I do, using other means there's such as life is that you try things and you just see how it goes and just see if people follow the energy. Some of you have watched it and I've had some really good feedback, and for that I'm really, really thankful. So I thought it would be a good idea to actually focus this last video for 2023. It's weird saying that, it's 15th of December today, but yeah, it's going to be the last one. I thought I'd do it as a kind of reflection of this year and things to kind of look forward to for next year. And the way I'm going to do that is actually I'm going to look at the top 5 reasons why using a health inequalities lens is absolutely critical to, I suppose, reversing the tide in the NHS right now. They're in no particular order, but if I'm going to rank them, we'll rank them thus. Number 1, obviously legally, it's a requirement, public sector equality duty. After we comply with the Public Sector Equality Duty and the Equality Act of 2010, as public bodies, we have to do what we can to eliminate discrimination, advance equality of opportunity, and foster good relations between different people. And to do that, we use different methods to do that, to ensure that you've got due diligence around that. So number 1 is it's a legal duty. So in theory, if we're not doing what we can to address inequalities, technically we are breaking the law. There is protections for people through the Equality Act 2010, and they cover all protected characteristics. Every single one of us has at least one of those protected characteristics or more. So if public bodies aren't doing what they can to protect people, then in theory they are breaking the law. Number 4, rather, we're going reverse. So number 4 is around the wider terms of health and well-being. So one of the reasons why it's so critical to have a health inequalities lens is because of the wider terms of health and well-being. So you might remember actually that at least 80% of what influences access, experience and outcomes of care is related to the wider determinants of health and well-being, at least 80%. So what the hell do we mean by wider determinants of health and well-being? What we mean are things like the air we breathe, the money that's in your back pocket, the job that you have, connections you have to your family, your level of education, things like the way you behave around behaving healthily, whether you smoke, if you drink, whether you lead a sedentary lifestyle, loads of things that influence the wider determinants of health and well-being. So it's only a small part, actually, really, that's within our gift to influence access, experience and outcomes of care, in terms of access to care. So if we ignore that big chunk of wider determinants of health and well-being, that's really, really short-sighted. So when we have a health inequalities lens on anything around the design of healthcare, we're thinking about the wider determinants of health and well-being. At least we must think about that, because that's what really influences a lot around where health inequalities start, and where they compound access, experience and outcomes of care. And then the other reason why that's important is that when we look through the wider determinants of health and well-being, we start to unpick what's going on, what's causing certain problems, what's causing people to access, experience and have different outcomes of care, some groups compared to others. It starts to create the conditions for change. It starts to give people power. It starts to give people agency. So number 4 is wider determinants of health and well-being. Number 3, quality and safety of care. Well, we made a video on this last month. That was the last video. If you haven't seen that, check that one out. So quality and safety of care. So what we found, I suppose 3 key themes that we found in that video, is that what we know is the health inequalities can be compounded, can make worse. Certain groups will fare worse than others, and good quality care and good patient safety can be experienced either unequally or inequitably. So The same can be said about any form of care we found, and that actually, fundamentally, the big take from that last video was that a disproportionate amount of harm from healthcare will compound the existing social or economic disadvantage that people face. So basically, if you're in a position where you are you're poorer or destitute, you have greater challenges around access, transport, poorer levels of educational achievement, you're going to be at a far greater risk of experiencing far higher levels of harm compared to groups who aren't in that sort of cohort. So patient quality and safety is massively important in that respect. Number 2 in the list, remember we're not really ranking, but in any particular order, insight to action and improving decision making. So, I mean, it's that old adage of knowledge is power, isn't it, at the end of the day? I always argue, and my colleagues will argue, that good knowledge management is a way of creating wealth. If we know things and we know how to do things well, it means we can be innovative, it means we can create wealth. And that definitely is going to have an impact on health inequalities as well. So what I'd do is I'd always urge colleagues to identify specific financial or performance measures that are bubbling away, that are really creating chronic problems in terms of our capacity to be productive. You can overlay that with different data around deprivation, geographical data, protected characteristics data, to try and find out what's going on and why things are happening the way they are. And then use things like costing data and things like that, and other financial information to estimate the impact of having a more equitable service, and estimating what would happen in like that. There's loads of other forms of intelligence and insight as well, not just quantitative data, what you can grab from what people say, the conversations you have with people. And that too also gives people agency, gives people power to actually be the agents of change. And all of this knowledge management, if we're going to term it in that umbrella, is going to create the conditions for change, and ultimately generate wealth. If we generate wealth, it means more tax. It means more money for all forms of public services, not just the NHS and health and social care. So yeah, knowledge management. And the last one, the one that doesn't get a lot of attention in terms of health inequalities, but certainly gets a lot of attention in the world of the NHS, is having a health inequalities lens makes darn good financial sense. In fact, it makes huge financial sense. Really, we're in a place now where we've got an opportunity for real innovation here. Moving away from that, I suppose we're in a bit of a predicament now. We're in a bit of a hamster wheel, where we're continually obsessively focusing on things like waiting lists, capacity, reducing waiting lists. A lot of focus is on that. And actually, really, that's the end of the process. If we focus far more on framing things around health inequalities and prevention, it gives us a bit more scope, a bit more headspace to be able to get off the hamster wheel that we've been placed on, I'd say we choose to place ourselves on, and focus more on finding things that are going to enable us to be more productive. Let's look at the facts here. If you look at productivity losses, and not just in the NHS, but productivity losses in the whole of the UK, due to health inequalities, it's about £33 billion is lost in the economy due to health inequalities. It's 33 billion. Add another 32 billion to higher welfare payments to people who are experiencing the higher levels of health inequalities, and then add to that as well people in the most deprived areas, the UK, half of which are in the top 2 quintiles. So yeah, they're going to have a lower life expectancy, and also become part of that cohort that contribute to the highest healthcare costs, and the highest, I hate to use the word, but I can't think of another word, the highest burden upon healthcare systems. And that can't be good for anyone. So massive opportunity to be able to think of things and design solutions to problems in healthcare around a health inequalities lens, by essentially owning up and admitting and accepting and realising that if you address health inequalities, actually you're addressing massive productivity issues as well. The two go hand in hand. So that's it. Top 5 reasons for wanting to look at health and equalities lens in 2023. My advice and gift to you would be to hone in on those things for next year. Do what you can to hone in on those things. In the meantime, if you've watched any of the videos this year, I want to thank you very much indeed. It's really, really helpful. It's great to get things off my chest, as I said at the beginning. Everyone likes to have a good moan sometimes. Not always having a moan. Sometimes I'm just literally just trying to share things and peel the onion on certain things. But I think, yeah, above all, next year is about being positive, isn't it? It's about looking at the face of things and trying to find new and different ways of addressing problems in a way that we haven't done before, and try new things as well. So in the meantime, bid you farewell. Have a happy new year, a good Christmas, and I will see you on the other side next year. Take care. Bye bye.